The effects of failure of various parts of the urinary system can range from incontinence to kidney disease, with a life-threatening loss of the ability to eliminate wastes. When the kidneys begin to fail, several symptoms may occur such as weakness, shortness of breath, widespread edema, swelling, rising potassium levels, and heart arrhythmias. Failure of voluntary control of urination is called incontinence. Incontinence may occur if the connection between the brain and the urethra is disrupted, or there is loss of muscle tone in the urinary system. There are several types of incontinence. Incontinence in small amounts, i.e., leaking or dribbling, can occur from coughing, laughing, or moving when the bladder is full. Some people feel an urge to void and then must go immediately, or incontinence may occur if they are not near a restroom. Some people have total loss of control of urination, resulting in the entire contents of their bladder being released involuntarily. The prostate gland encompasses the urethra in males. As males age, the prostate gland grows, known as benign prostate enlargement, BPE. Because prostate enlargement puts pressure on the urethra, the urine may become blocked. Older men may experience difficulty starting the stream of urine or become unable to completely empty their bladder. If the blockage becomes significant, it can cause infection when urine remains in the bladder for long periods of time. In these cases, a urinary catheter may be placed to reduce the retention of urine, or a surgical procedure may be completed to reopen the urethra. This slide and the following 3 slides outline the common chronic conditions of the urinary system and related interventions. Urinary incontinence. Definition: inability to control the elimination of urine. Symptoms to report: change in the frequency or amount of incontinence. Specific interventions: implement a toileting schedule. Prompt residents to void before they feel the urge to do so. If the client is unable to communicate the need to void, check their incontinence product at least every 2 hours to keep the skin dry and free of breakdown. Urinary tract infection, UTI. Definition: infection of any part of the urinary system. Symptoms to report: increased frequency of voiding, pain, itching, or burning with voiding, voiding in small amounts, strong odor, dark or cloudy urine, and/or sediment or blood in the urine. A sudden increase in confusion can also indicate infection. Specific interventions: provide good perineal hygiene. Implement a toileting schedule. Encourage fluids for good hydration as appropriate. Assist with activity as tolerated. Wipe from front to back. Kidney stones. Definition: deposits of minerals from concentrated urine that form a mass in the kidneys. Symptoms to report: increased pain in the abdomen or pain with voiding. Specific interventions: encourage fluids as appropriate. Promote activity as tolerated. Encourage prescribed diet to prevent formation of stones. Chronic kidney failure. Definition: kidneys are unable to adequately filter and remove wastes and fluids from the body. Symptoms to report: puffiness around the eyes, frequent urge to urinate, urination in increasingly smaller amounts, dry and itchy skin, and/or fatigue. Specific interventions: encourage prescribed renal diet, decreased amounts of sodium, potassium, protein, and phosphorus. Follow prescribed fluid restrictions and provide comfort measures for associated dry mouth, such as hard candy, ice chips, or breath spray. Encourage quitting smoking. Assist in maintaining healthy blood glucose levels in people with diabetes. Encourage physical activity as tolerated.